New York Methodist Hospital has made a major commitment of time and resources to offer wide-ranging and progressive pediatric services for our community. Chairman of Pediatrics, Dr. Narula, takes us on a tour of the inpatient unit, which includes a private room for every child, a schoolroom, a playroom, and our Pediatric Intensive Care Unit, or PICU.
I, as a chairman, tell all the residents that we have to treat every child like it was our own child, and that's our philosophy. We put a child who's sick in the shoes of our own children, and that's how we treat them. And I think we've had great results because of that. The hospital is beautiful, it's comfortable, it's family-centered, people are compassionate, and very, very knowledgeable. All the attendings are board certified in their specialty, and they're very well qualified. But in addition to the qualification, I think the hallmark is we are very empathetic to the families and to the children, and we try to treat the whole family. We understand when a child is sick, it's very, very stressful, and everyone in our team understands that.
Children from 2 months up to 21 years of age needing special inpatient attention are treated in our Pediatrics Intensive Care Unit. Each room is designed to offer sleeping and bathing accommodations for parents.
We can deal with all kinds of problems. They can range from post-surgical complications to traumatic injuries to managing respiratory problems such as severe asthma. We have a wonderful interdisciplinary system where we meet together to discuss the care on a daily basis with the nursing staff and the families. The families are very important. This is a highly anxiety-provoking experience, and we're always looking at the child and their family being the priority to help them through this experience and get them back home to their environment.
A child's medical emergency can be especially frightening. At New York Methodist, we have a technologically advanced pediatric emergency room and a kid-friendly staff dedicated solely to the emergent care of children. Dr. Robert Van Amerongen, known as Dr. Van, tells us more.
I think parents have a lot of concerns when they bring the child to the emergency room. I mean, I'm a parent of 3 children myself, and really they want to know what's wrong with their child, and they want a lot of reassurance also. We have to develop a relationship with the parents so that they trust us. We include all the specialists and the subspecialists that we need to make sure your child gets the right kind of care and compassionate care. And so all the doctors and nurses are specifically trained in dealing with children. I mean, that's our only reason for being here.
Dr. Van shares his secrets for making children comfortable in the ER.
You don't just rush over to the child and whip off your stethoscope and start listening to them. You want to sort of talk to the child. Sometimes I have a stuffed animal on my stethoscope. I have this little ID tag, and the children play with it, or I show them how to play with it. Get yourself down to their level and talk directly to them so that you're not towering over, and you don't just rush up on them, some stranger.
At New York Methodist, providing the best medical care for children is a serious business. But we never forget that children, well, are children. So we have a friendly, energetic, fun-loving, and empathetic staff of top-notch pediatricians. There are dozens of doctors to choose from, with many available 6 days a week and evenings.
You know, this is a young neighborhood, Park Slope, so we have lots of young families, lots of newborns. We like to see kids up through their teen years, but lots of the families are young.
When they're infants and babies, they come for their shots, so we see them every 3 months. So we get to know the family because they're here so often just for their well visits.
We do have kids that I have followed now for 11 years, and it's wonderful to see them grow. And it's very important for us as pediatricians to explain to parents that there are very many right ways to do things, and as long as they pick one of them, that's okay.
What's nice about Methodist as opposed to other private practices in the community, because we teach, we're learning all the time, and we're challenged all the time, and we have students who throw questions back at us, and we have to look it up sometimes. And I think we're just on the leading edge and the cusp of medical technology.
It's one of the nice things working at a hospital. We have communication with the obstetric department, so if there are questions during the pregnancy, they can let us know so that we're prepared.
We have every subspecialty. You don't have to go somewhere else. You don't have to leave Methodist. You go right across the street. You go to cardiology, pulmonology, nephrology. Anything you want, we have it here.
We want to have compassionate care of good quality and make sure that the families that come here are happy. And so that's our goal, and we'll continue to work towards that.
I think that we're on a daily basis improving the care to children in this area.
Between the general pediatric services, the subspecialty services, the surgical services, and certainly the emergency services, we have what it takes to compete with the best of them.
If you're looking for an environment where people really go the extra mile to really advocate for the babies and advocate for the parents, this is the place you'd be looking for.
I was lucky. I was lucky that in starting out with Dr. Kofinas, I ended up with his brother, and then I ended up in a really good labor and delivery unit, and my babies ended up in a phenomenal NICU unit. And then we ended up with a great doctor who will see them till they're 18. And so we got really lucky in finding a great package with everything that we needed. I never thought to go outside of Methodist for any of my children's needs.
We hope you enjoy learning about New York Methodist's services for women and children. If you'd like to make an appointment or learn more information, call one of the numbers on our screen or visit our website. We look forward to being your family's healthcare provider for years to come.